Do you frequently feel thirsty, tired, or have hazy vision for no apparent reason? It can indicate that your blood sugar is excessively high. In this video, we'll talk about 7 concerning symptoms to look out for, as well as the effects of high blood sugar. Starting off with number 7 is frequent urination. A typical sign of high blood sugar levels is frequent urine, also known as polyuria, which is more prevalent in people with diabetes. An excessive amount of glucose is flowing in the bloodstream when blood sugar levels are raised. Since there is too much glucose in the urine, the body loses more water through urination. This is known as an osmotic diuretic. Larger amounts of urine are produced as a result of this process, which causes frequent urination. High blood sugar levels can also cause dehydration in addition to increased urine production. The body loses fluid as a result of the frequent urination, which makes you feel extremely thirsty. This may set off a vicious cycle, whereby frequent urine results in dehydration, which then increases thirst and additional hydration. Frequent urination can be annoying and distracting, impacting daily routines and sleep cycles. To reduce this symptom and avoid any consequences related to diabetes, it is crucial to adequately monitor and manage blood sugar levels. For accurate diagnosis, treatment, and management of high blood sugar levels and related symptoms like frequent urination, speaking with a healthcare professional like a doctor or endocrinologist is crucial. Coming in at number 6 in the list is excessive thirst. Polydipsia or excessive thirst is a typical sign of high blood sugar levels that is frequently present, especially in those with diabetes. Elevated blood sugar levels can cause a state of dehydration and make you feel thirsty all the time. The body tries to make up for the lost fluids by making people with high blood sugar levels feel excessively thirsty. Even after drinking enough liquids, the persistent feeling of thirst can be challenging to relieve. Moreover, an imbalance in the body's osmotic pressure can result from the high blood sugar levels linked to diseases like diabetes. As the body tries to maintain its fluid balance, this imbalance affects the water content of cells, increasing thirst. In order to stop further dehydration and related consequences, it's critical to treat excessive thirst, which can be an annoying symptom. To help reduce excessive thirst, blood sugar levels must be managed with appropriate medication, dietary changes, and lifestyle improvements. It is recommended to seek advice from a medical expert, such as a doctor or endocrinologist, to identify the underlying reason of excessive thirst and create an effective treatment strategy. Moving forward to number 5 in the list is fatigue. Weakness and fatigue are typical signs and symptoms of high blood sugar, especially in those with diabetes. Consistently high blood sugar levels can result in a number of mechanisms that amplify sensations of weakness and exhaustion. Additionally, high blood sugar levels can alter sleep patterns, resulting in restless sleep or even insomnia. Daytime fatigue and an overall sense of exhaustion can also be caused by sleep problems. Furthermore, excessive urine brought on by elevated blood sugar levels might cause dehydration. Dehydration can result in decreased blood volume and poor circulation, which can worsen weariness and a sense of weakness. Effective blood sugar management is essential to combat the weakness and weariness brought on by high blood sugar levels. Regular monitoring, using medication or insulin as needed, adopting a balanced diet, and getting regular exercise, controlling stress levels, and getting enough sleep are all part of this. Stepping on to number 4 in the list is unexplained weight loss. Unintentional dietary or physical activity modifications do not cause a considerable drop in body weight, which is referred to as unexplained weight loss. When combined with other symptoms of diabetes or high blood sugar, it might be a worrying symptom. People with high blood sugar levels may experience unexplained weight loss for a variety of reasons. The body may have trouble using glucose as a source of energy when blood sugar levels are regularly high. As a result, it begins to break down alternate energy sources, including muscle and fat tissue, which causes weight loss. This happens as a result of the cell's inability to access the bloodstream's glucose, which places them in a condition of energy shortage. Furthermore, elevated blood sugar levels can result in increased urination and consequent fluid loss, which can help people lose weight by causing them to lose water weight. Increased metabolism might sometimes cause unexplained weight loss. Increased metabolic demands can result from elevated blood sugar levels as the body tries to make up for the inability to use glucose by burning more calories. Over time, weight loss may be the outcome of this increased energy expenditure. Additionally, unchecked high blood sugar levels might boost appetite, yet the body might not be able to properly use the calories that are consumed. Despite increased appetite, weight loss may occur as a result of an imbalance between increased food consumption and inefficient energy use. Unexpected weight loss may also be a sign of various underlying medical conditions such as malabsorption problems, thyroid conditions, or some malignancies. To stop additional weight loss and keep a healthy weight, blood sugar levels must be controlled using medication, dietary changes, frequent exercise, and lifestyle changes. Coming in at number 3 in the list is blurred vision. When blood sugar levels are continually high, especially in those with diabetes, symptoms including blurred vision can appear. It is crucial to realize that visual blurring caused by high blood sugar levels is typically transient and curable with appropriate care. Vision can become blurry as a result of changes in the shape and flexibility of the eye's lens, brought on by high blood sugar levels. This happens because too much glucose can accumulate in the lens, affecting how well it refracts light and focuses images on the retina. The vision gets cloudy or blurry as a result. According to the blood sugar level, the blurriness may occasionally change throughout the day. The blurriness tends to get worse with high blood sugar and may get better with low blood sugar. Diabetic retinopathy, a disorder marked by chronically increased blood sugar levels, is a result of damage to the blood vessels in the eyes. If neglected, diabetic retinopathy can result in more serious vision issues such as floaters, vision loss, or even blindness. Controlling blood sugar levels is essential for avoiding and treating visual problems. Moving forward to number 2 in the list is slow wound healing. High blood sugar levels are frequently linked to slow wound healing, especially in those with diabetes. The body's normal healing mechanisms can be hampered by elevated blood sugar levels, which can result in slower wound healing and a higher risk of infection. Chronically high blood sugar levels can harm blood vessels and nerves, resulting in decreased blood flow and feeling in particular parts of the body. The transport of oxygen, nutrients, and immune cells to the site of a wound is hampered by this decreased blood flow, which impedes the healing process. In addition, immune cells like neutrophils and macrophages, which are essential for preventing infections and accelerating wound healing, might operate poorly under conditions of high blood sugar. This compromised immune system also slows the healing of wounds. Additionally, having high blood sugar levels can make the body's entire system chronically inflammatory. Longer healing time frames can result from chronic inflammation that gets in the way of tissue regeneration and repair processes. Furthermore, small blood vessels might be harmed by high blood sugar levels, impairing circulation. A healthy blood flow is crucial for wound healing because it brings the wounded area the nutrients and oxygen it needs. Reduced tissue generation and delayed healing are both possible effects of impaired circulation. Coming in at number 1 in the list is increased appetite. Polyphagia, or an increase in appetite, is a sign of elevated blood sugar and is particularly common in people with diabetes. Elevated blood sugar levels can interfere with the way the appetite is normally controlled, causing excessive hunger and increased food intake. A lack of insulin or insulin resistance may prevent the body's cells from adequately using glucose for energy when blood sugar levels are regularly high. The brain may receive a signal from the cells telling it to eat more in an effort to get more energy as a result. A persistent hunger and an increase in appetite may result from this. Additionally, quick energy ups and downs brought on by blood sugar swings can boost the desire for sweet or high-carbohydrate foods. Although they might be a quick source of energy, these foods can also raise blood sugar levels and cause an increase in appetite. To control appetite and keep a healthy weight, one must control blood sugar levels with the use of appropriate medication, dietary changes, frequent exercise, and lifestyle changes. It's important to consult a healthcare professional if you notice any of these 7 symptoms. If you're aware of any other symptoms related to blood sugar levels, do let us know in the comments below.